Okay, for this module's clinical management, clinical pearl, I want to discuss the balance between having optimism and pessimism when it comes to giving a prognosis and discussion with a patient that is chronic. So, one of the things I think it's important to really think about is, if you're too optimistic, you can give false hope, and if you're too pessimistic, then you can give your patients really no hope and no motivation to follow through a task. And what's the balance, and how do you keep that in check? So, I would say, first of all, as a healthcare practitioner, what is your general tone? Are you more optimistic? Or are you more pessimistic? And then you might have to balance one side versus the other side. So, when I do a follow-up, I can tell you with a chronic patient, let's say we talk about some of the chronic conditions that really have difficult prognoses, like someone who's had a severe brain injury, someone who has an ongoing inflammatory autoimmune disease, someone who's got an ongoing chronic, incurable, let's say, a chronic inflammatory condition. How do you set the tone? What kind of things do you discuss? So, first of all, I think what a lot of naive practitioners do, and this happens all the time, is just really too much optimism. Especially people that jump into functional medicine, they can actually see patients get better for a while, and they're really convinced that if they just go in there and fix their leaky gut and fix their microbiome, that everything in their health and life will completely change. And that's not it's not that simple. So, what happens when you give way too much optimism in a case management? It gets the patient really excited, they feel good, you feel good, but then there's a big crash. And many times, overly optimistic practitioners and people that are new to functional medicine that really don't or haven't worked with a lot of chronic patients or maybe over their clinical experience tend to be way too optimistic when it comes to outcomes. At the same time, people who've been in practice for a long time or just generally pessimistic tend to be overly pessimistic, and they can't get their patients' motivation to get engaged, and it really impacts everything. So obviously we all have different communication skills and different abilities to read body language, and we have to look at our own bias of our optimism and pessimism, decide what to do. I have found personally that I tend to be more on the pessimistic side, and but at the same time I don't want to lose hope for the patient. So the key thing of really discussing what is a realistic diagnosis. So if someone has an uncurable inflammatory condition, like they've had ulcerative colitis their whole life, to go in there and say we're going to reverse this and we're going to cure this is really, I think, first of all, irresponsible. It can create false hope. So there's some level of understanding what the patient's expectations are, and then having a real discussion of what's there. So I would be pessimistic of, oh, we're going to cure this. It's going to be, I personally don't like to work with patients that are like, well, I'm going to be the example. I'm going to be the one that is so different than everyone else. I don't like working with those types of patients because, it's not realistic. And your patient's outcomes also have a direct impact on you as well. At the same time, even people that have debilitating chronic inflammatory conditions or autoimmunity or severe brain injury that has some permanent injury to the brain, there is the ability to improve their function at their current state. So, the balance of trying to figure out what the real prognosis is and having an honest discussion about it without being overly pessimistic is really important. At the same time, you can function a lot better is very realistic for almost every condition. You may, whether it's like you may function a lot better, you may recover faster. The reactions you're having, the inflammatory acute attacks can potentially be less. And just having those realistic discussions. It is absolutely important to discuss about what would be realistic, but also what's positive and what they have to look forward to, and how changing quality of life is also really, really a big deal. So I would say my encouragement to you is to really think about, are you overly optimistic? Maybe balance yourself out. Or you're overly pessimistic, then try to balance yourself out. And sometimes we have to remember that and where we are with our own personalities, and making sure we don't give false hope, but at the same time, we have realistic expectations.